Good afternoon, class. My name is John Watts. I'm a student at Colorado Christian University. And tonight I want to talk about long term care. My presentation tonight will go over what is long term care, ways to pay for long term care, and how the government also contribute to long term care as well. So I want to start out tonight just a little bit about long-term care and how it can be expensive and how much it can cost you a day to live in a nursing home or an assisted living program. It can cost you up to $225 a day. Um, to live in a nursing home, $119 a day for an assisted living program, um, $20 an hour for just having someone to come in and take a look at you, an LPN or just a healthcare worker. It can be very costly um, to maintain and to live in a healthcare long-term care facilities. What is long term care? Long term care involves services that a person needs when they are no longer able to perform these safety tasks on their own. Nearly 11 million people in the United States use some form of long term care, and that number is projected to double by the year 2050. Um, older people living longer. They need healthcare facilities, um, and there will be ways to pay for that type of care as well. Um, so, long-term care is just a service that's needed in the years ahead. Although healthcare insurance may cover some Medicare needs by people living with chronic illness, it provides little or any coverage for a person services like bathing, dressing themselves. All these things are considered part of the long term care. Now, your long term care in our government, um, slide number 5, the government alone cannot solve each problem of our time, all social problems of our time. So, the research is governed by following two questions. Are nonprofit faith based nursing homes more effective in providing Medicare and Medicaid services? Um, what money do they contribute to help us elderly people? Um, the government plays a role in our care, but we need, as people, to keep the government out of our everyday lives when it comes to our health care. Medicaid and Medicare definitely is an option when considering long term care. It definitely helps pay for those services. Uh, um, Slide number 7. In his State of the Union address in February '86, President Ronald Reagan asked the U.S. Department of Health and Human Services to study and provide recommendation on ways that private sector and government could work together to protect American families against the cost of catastrophic illness, um, including the sometimes devastating cost of long-term care. Secretary Otis R. Bowen, who has had a long standing personal and professional interest in catastrophic health care calls, accepted this challenge. Slide number 8, um, the public government funding and private sector funding. In 1986, almost one half of all nursing home expenditures were paid by federal, state, and local government. The Medicaid program paid 41.1%, and an additional 6.4% was paid through Medicare. The Veterans Administration programs and other non-Medicaid state programs, most of the remainder, 51%, were paid directly out of pocket by an older person and their families. Private insurance paid less than 1% of the nursing home costs. It is later, it is this later private sector portion that we think could be leveraged to become a significant factor in protecting the elderly from financial burden and a large out-of-pocket amount. Now, slide number 9 also goes over more information about the private sector of healthcare and also long-term care. Private sector managed healthcare organization or experimenting with ways to better coordinate home care and community services. An even more promising approach is an agent network that allows local nonprofit and agencies to work together to assess the needs of each older person, identify appropriate services such as home aids, and administer cost effective community programs. Family and older people who find agent networks good to work with because they provide a one stop information and supportive social network. The emphasis is on care and not profit. Now, slide number 10 goes over managed care and encourages savings through the private sector. One method that has been used to save money and encourage home care for seniors involves the integration of different sources and fundings from Medicaid and other public and private sources. And a private sector managed long term care umbrella programs operated in the local or regional level. This program receives funds from various sources and pays out a set per person rate to purchase care from various companies. And this also is just a different way of managing um, your care through the private sector and ways to pay. Now, slide number 11, um, it's like my conclusion. Long term care is an ongoing battle. There's a lot more we need to know and know quickly. In order to ensure that future long term care system is responsive, effective, and desirable, the department will continue to foster work in long term care and wants to work with insurance companies, actuaries, and state Medicaid program director, as well as the traditional academic community, to improve data on long term care needs, financing, and the economic status of persons who need long term care.